Very much. We are kicking off a special week on Summer of Secrets, all about plastic surgery. It is a $12 billion a year industry.
And we've invited 3 board-certified plastic surgeons here to answer your questions about different procedures. Dr. Michael Jones, Dr. Haida Herman, and Dr. Stephen Davis. And before we get started, a reminder, it's always best to check with your primary care physician before making any serious decisions about your health. But meanwhile, good morning to all of you. Thank you so much. So we actually took to Twitter, social media, the Plaza, for some questions. I want to get to the first one. We have, was this IRL Makeup asked, I have bags under my eyes, but I'm in my 30s. What options are there to fix this? Dr. Herman, what do you think?
Well, that's the most common complaint I hear in my practice, actually, and bags can make you look really tired.
Is it hereditary?
It is hereditary, absolutely. It's genetic. And actually, if there is a young person with bags, it's best to do that earlier than later. Oh. And we have options now, surgical options that have no scar and very minimal downtime to just take the bag down. The most important thing to realize, though, is that there could be some volume loss, some hollowness that could make you look tired as well. And now we have non-surgical options to complement surgery, to put it together in the right combination. As a plastic surgeon, one of my goals is to really get aesthetic synergy, which is how to put surgical and non-surgical options together in 2015 to get the best results.
So even in your 30s, it can be a good idea for some people.
That's the one time that if you have bags in your 30s, you may want to think about surgery because that's just going to get worse.
Okay, we brought in some friends from the Plaza to ask you a few questions. Kenny from Oklahoma is with us. Kenny, I can't imagine a good-looking guy like you would have any questions about plastic surgery, but try them.
What is the success rate for liposuction in men over 50?
Oh, good question.
Well, wow, that's a great question. Liposuction for men over 50 is still a viable option. As we get older, our skin elasticity decreases. So it's ideal to do liposuction at anywhere between 20 to 30 because your skin has enough recoil that it can snap back. As men, we tend to have a little thicker skin, a little better elasticity. So usually with women at around 40, we start to say, well, maybe liposuction is not the best option. But usually with men with good, thick turgor to their skin, liposuction is still a very viable option and can work well.
Thanks, Kenny.
Thank you.
Appreciate it.
All right, next up, we have another one from Sandy on Twitter who wants to know, how do you know which doctor to trust? That's the million-dollar question.
That's something that, everybody really wants to know. Who's going to keep me looking the best and also keep me safe? And I think it's very important to, go by your friends and have understandings about that. But here's what I always say. Make sure that the doctor actually has privileges at a hospital to do the procedure that you're asking to have done. Because I think that in a lot of ways separates out people that are just doing a certain procedure in their own office from people that are actually doing it because they were board certified and trained in doing it.
Well, people sometimes associate cost with being the best, but you see Hollywood stars all the time who have unlimited funds, and they have, quote-unquote, bad work. How much of it has to do with your body type?
See, but I think the synergy, like you were saying, trying to make sure that the patient and the doctor are on the same page is key. Because I always have patients that come in my office and go, I definitely don't want to look like this celebrity. And they always say the same thing. Didn't they have enough money to go to a real good one? But I think sometimes that patient wanted that result. They may have gone to the doctor and said, I want lips to look like that. I want to look this way.
Really?
Yes.
So and someone goes in and says, I want to look like Joker, because there are some people who end up looking like
just have to say no.
That's why we have to actually, as the doctor, we actually have to say no to the patient or just make sure that they understand what they're really asking for.
Let's get another question from the Plaza. Debbie from California. Hi, Debbie.
Hi, good morning. My question is, what is the least invasive treatment to make yourself look 10 years younger?
Dr. Herman, you want to take that one?
Yes, that is an excellent question. We have so many exciting new technologies. The least invasive treatments are injectables and muscle relaxants and treatments for the surface of your skin, obviously. The more luminous your skin is, the better you're going to look. But the most important thing to keep in mind is you want to look like yourself no matter what you do. You don't want to change your look, just like you said. And number two, you want to make sure that there's someone who really pays attention to where and how much of the material to put in the right place. So the aesthetic planning has to be really proportionate and follow your anatomy to really bring out what's unique in your face.
Wow, great answers, doctors. Thank you so much. Your
Thank
skin's
you.
flawless. Got that little dew going on. I
Thanks,
love
Debbie.
it. Up next, the tricks